The MacPro Help Desk team welcomes your suggestions for our training and reference materials. Please contact us with your feedback and comments on this training, or if you need other MacPro assistance. You may contact us via email at macpro_helpdesk@cms.hhs.gov or by phone at 301-547-4688.
So for the next few slides, we're going to summarize and highlight some of the updates that were presented earlier in the presentation with visuals of where you'll see these updates. This slide is a summary of the core measures for child, adult, and health that are new for federal fiscal year 2020. And this slide is a summary of the measures that are retired for federal fiscal year 2020. So moving on to the general updates. For the measures listed on this slide, there are new numerator, denominator, and rate categories to report on in the performance measure section. For the WCC child measure, new NDR categories include counseling for nutrition and counseling for physical activity. For the adult PCR measure, the new categories include count of beneficiaries in Medicaid populations, number of outliers, and the auto-calculated outlier rate. For the Health Homes PCR measure, the new categories include count of enrollees in health home populations, number of outliers, and the auto-calculated outlier rate. And as mentioned before, on the LBW child measure, if a state indicates they are not reporting on this measure, they now have the option to request that CMS calculates the report using the submitted natality data compiled in the CDC Wonder tool. And for the last general update, in the childhood immunization status measure, there's a new immunization registry option available under the data source section. And the option is available for administrative and hybrid options. Now we'll move into the COVID-19 related updates. For all measures, if a state selects to not report on a measure, they will now have the option to indicate that it was a result of COVID-19. The option is labeled Limitations with Data Collection, Reporting, or Accuracy due to the COVID-19 pandemic. When selecting this option, states will be required to provide further description. The second COVID-19 update relates to measures that can be calculated using the hybrid method. States will have the option to request to use their federal fiscal year 2019 data if their ability to conduct chart review was impacted due to the pandemic. On the next 3 slides, we will briefly show which core measures this update applies to. On this slide, the child measures are calculated using the hybrid method, and this COVID-19 update applies to them. The update also applies to the adult measures listed on this slide. And finally, it applies to the health home measures listed here. Now we'll go over some tips and tricks for using MacPro. A tool that is helpful for users is the report summary screen. It's available when a user accesses a quality measure report through the Records tab. The timeline at the top of the screen indicates what stage of the workflow a report is currently in. The created status indicates that the report is with the state editor and has not yet been submitted to the state point of contact. An update indicates that the report is with the state editor following submission to the state point of contact. This means that the state point of contact returned the report to the state editor for further revisions. In review means that the report is with the state point of contact. At this stage, the state point of contact is currently reviewing the report before it's submitted to the state director. Awaiting certification notes that the report is currently with the state director. Once the report has been reviewed, the state director must certify and submit the report to CMS. NCMS review tells us that the report has been successfully submitted to CMS and is under review. An SMI would mean that CMS has further questions on the report. It can mean that the report is with the state or CMS. If the report is with the state, that means CMS has submitted their Seek More Information request to the state. If it's with CMS, it means that CMS is reviewing the state's response to the SMI request and has not closed it. Finally, CMS review complete means that CMS has completed their review of the report and has accepted it. In MacPro, users are able to save and print their quality measure reports as PDF documents. Please note that there are differences in capabilities between browsers. So if you'd like page breaks in your PDF, we recommend using Chrome or Internet Explorer. If you'd like a shorter PDF without page breaks, we recommend using Firefox. Taking a look at the next tip, if there are multiple users with the same role and access to the same authorities in a state, multiple users can receive a task for a single report, but only one user can accept the task before acting on it. This removes the task from queues of the other users to ensure that multiple users do not have the report at once. Once a user accepts the task, they will be associated with the report going forward in the workflow. A MacPro session timeout occurs when users lose connectivity, observe issues with system responsiveness, or encounter issues navigating through MacPro after working in the system for a period of time. To avoid a session timeout, you must routinely select Save while entering data or validate your entries periodically. After working in MacPro for 25 minutes without performing an action, users will receive a prompt that indicates your session is about to expire. Upon receiving this prompt, you may continue your session by selecting Resume within 2 minutes. But if you do not acknowledge the prompt within 2 minutes, you will be automatically logged out. Please note that performing an action in MacPro is defined as routinely validating or saving entries. Simply entering data is not considered performing an action. It is recommended that you select Save periodically while logged into MacPro. This slide shows the browser and software requirements for using MacPro. While I won't read everything on this slide, I want to highlight that Google Chrome is the optimal web browser for using MacPro, and you must have version 11 of Internet Explorer. So let's go over some additional resources available to users to help guide you while using MacPro. Much of MacPro's reference material is located on Medicaid.gov. The first page is the MacPro portal page, which provides links to reference documentation. The second is the MacPro and Training and Help page. This page provides links to training deck and recording. MacPro resources are located on Medicaid.gov. We talked about these resources throughout today's training, but this slide contains links to all of them. The MacPro team has created 3 modules that walk through the submission process. They're located on CMS's YouTube channel and are linked on this slide. The first module shows how a state editor creates a report, edits a core measure, and submits the report to the state point of contact. In the second module, the state point of contact reviews a report, sends the report to the state director, and then the state director reviews and certifies the report to send to CMS. The last module shows how a state point of contact and state editor answer an SMI request and update the report accordingly. In addition to using the resources available on Medicaid.gov, you may want to contact the MacPro Help Desk. For issues related to MacPro Access or the MacPro system, you can reach the MacPro Help Desk via the email address on this slide or by phone. The Help Desk is available Monday through Friday from 9 a.m. to 5 p.m. Eastern. So let's talk about the next steps. As we mentioned at the start of our training, quality measures for federal fiscal year 2020 is now available in MacPro. If you do not already have an EIDM ID or MacPro Access, we recommend you do that soon. Instructions providing an overview of how to gain access to MacPro through the CMS Enterprise Portal are located on Medicaid.gov via the links on this slide. As a final reminder, the reporting deadline is December 31st, 2020. We wanted to thank you all for taking the time to attend the session. Again, if you have any questions or feedback, please contact the MacPro Help Desk at macpro_helpdesk@cms.hhs.gov. And we hope you all have a great day. Thank you.
The MacPro Help Desk team welcomes your suggestions for our training and reference materials. Please contact us with your feedback and comments on this training, or if you need other MacPro assistance. You may contact us via email at macpro_helpdesk@cms.hhs.gov or by phone at 301-547-4688.